When we have a healthy microbiome, it helps us with things like hydration. Super important, obviously, is that we have adequate hydration in the body and the tissues. It helps us with systemically reducing inflammation. They help us with production of nutrients.
Welcome to the Peak Health Podcast, where we dive into practical science-based strategies to help you live longer, stronger, and better. Today, we're talking about one of the biggest disruptors in the health world right now, GLP-1 agonists like Ozempic and Wegovy. They're everywhere from celebrity headlines to your doctor's office. These medications promise rapid weight loss and blood sugar control. And because they are so effective, companies that we've grown up with, like Weight Watchers, have filed for bankruptcy. But here's the thing. What if you could activate some of those same fat-burning, appetite-controlling pathways naturally without the prescriptions, side effects, or expensive price tags? To help us unpack how to naturally stimulate GLP-1 and GIP in the body, I'm joined by Dr. Jocelyn Strand, a naturopathic doctor and the Senior Director of Clinical Education and Research at Biocidin Botanicals. She is a leader in the microbiome science, a champion of botanical medicine, and a master at translating complex science into real-world strategies. Welcome, Jocelyn.
Thank you so much, Dr. Goop. I'm very happy to be here.
Happy to have you. And we had a very fun, interesting conversation prior to starting the podcast. In fact, you mentioned you do a lot of the things that we're going to talk about, but then you also started taking tirzepatide,
I
which is a
did.
GLP-1 and GIP agonist afterwards. So we can probably dive into that as well, because certainly there is a use for this medication. And I'm not saying that there's no use by,
Mhm.
introducing the podcast as I did, but it really should be taken in concomitantly with trying some other things. And we'll talk about those lifestyle changes and simple changes that you can do. So let's start now by discussing what exactly GLP-1 and GIP are and why they're so critical for weight, energy, blood sugar, etc.
Okay, great. So, and I'm happy to share my experience as well, and agree 100% with you that the most important piece is really making sure we have the sort of diet and lifestyle dialed in, and not just depending on that one medication or one shot once a week. There's so much more that we can do to support our bodies and nourish our bodies. So, GLP-1, it stands for, I guess, glucagon-like peptide 1. That one is produced in what are called L cells in the gut. And then we have glucose dependent insulinotropic polypeptide. That's GIP. So we'll just call it GLP-1 and GIP. But GLP or GIP is produced in the K cells. And so the L and K cells are what are called enteroendocrine cells. And they are cells, they make up 1% of our total gut lining, and they actually only have a lifespan of 3 to 5 days, which was shocking to me. But I think that's really interesting because it illustrates how quickly our body can heal if we take good care of our body, get obstacles out of the way, and offer it some support. But even though it's only 1%, those cells are only 1% of our intestinal lining. It's actually the largest endocrine organ, so a hormone producing organ in the body, which is incredible to me. So very important place for us to direct some attention and therapeutics.
Absolutely. So now you said that the half-life is only 5 days for these cells, and they are the ones that secrete all the GLP and GIP in the body itself.
Yes, exactly. So GLP-1, so their full lifespan is 3 to 5 days, and they respond to signals in the gut and throughout the body for the release of GLP-1 and GIP. And GLP-1 and GIP are known as incretins. That's how I pronounce it. I don't know if you pronounce it that way, but
Yeah.
they're responsible for the incretin reaction in the body, or the incretin effect. And what's interesting to me is that it's responsible for 70% of our insulin response. So where I think we've kind of shortcut that. At least when I was in medical school, it was blood glucose, insulin, glucagon. We didn't really look at GLP-1, and GLP-1 was just beginning to be looked at all at that time.
Exactly.
But this is actually, a huge part of the main part of our insulin response following a meal, which is important because that means we put the sugar where it belongs, where it gets burned inside the cell, where we can use it for fuel.
Absolutely. And obviously, this has become a household name because of the success of these drugs that have been created. Um, why has it taken as long as it has to really understand how these how these substances and these incretins work.
I think that's really interesting. I mean, I know that GLP-1, I think, was only discovered in the 80s, 1980s. So it was a hormone that we didn't even know existed before that. And I don't remember the underlying, it was just kind of at adjacent finding in some other research that they were looking at. I think it was because, oh, I know, I remember now. It was because when you increase, like if you do a bolus or a shot, like an IV shot of glucose, you don't get the same response in your body as you do when you eat it, when you eat sugar. And so they were searching for the missing link in that pathway, and it was the GLP-1 produced in the lining of the gut. So that's what initiated the discovery of those hormones.
That's so interesting. And before we talk about sort of like, how they're produced naturally or what stimulates their production rather, let's just talk about the GLP-1 and GIP agonist drugs.
Mhm.
What is, when would you take these? What are the side effects? There's obviously benefits. What are the risks?
Yeah, really, really great question. So I guess the first thing is the really what's really different from the GLP-1 that we produce in our body and a GLP-1 med or GIP and GIP-1 med is that it basically has been chemically altered enough to extend its half-life in the body. So GLP-1 or GIP will have a half-life, which means that half of it will be gone in 5 to 7 minutes, whereas GLP-1, like semaglutide, will last for 6 days, the half-life. And so that's why it's so different. It behaves so differently. It is what we would call a bioidentical hormone. It looks the same. It binds in the same way in our body. Similar to how I would think about how estrogen or testosterone, bioidentical, taking those from outside the body behave, except that it has this long half-life. And so that's how the medications themselves work. And I think, what we're seeing, I love that you call it a disruptor, because I think it's really changing the field of medicine right now. It's really incredible to watch people who've been hopeless, people who've tried everything, can't lose weight, or they have metabolic syndrome, and they're exercising, they're eating healthy, or this is very common for women with hormonal, like PCOS, polycystic ovarian syndrome, or hormonal abnormalities or dysregulation. Perimenopausal or postmenopausal women often will have this sort of midsection weight gain that comes out of nowhere with no other changes made. And so for people like that, these medications can be extraordinarily helpful. And I would put myself in that category. I know I mentioned that to you, but it is really sort of, I feel like, levels the playing field in terms of metabolic function. So it can support healthy metabolism, which is why we're seeing what we are in terms of the ways that it has activity outside of just weight loss, outside of just blood sugar regulation or dysregulation. We're seeing, I mean, there's research. So phase 3, it's really starting to be highly researched for things for Parkinson's disease, Alzheimer's disease, kidney disease, joint or pain, body pain, like fibromyalgia. It's
Right.
kind of extraordinary, the number of ways, because it's supporting metabolic function. It also has anti-inflammatory effects. So, but of course, like anything, more is not always better, right? And
Right.
so where we think it could be really useful when applied in a certain way, a lot of people conventionally are taking it, they're taking it the way it was offered in research, which is to start at a certain dose and then you ramp after a month. Every month you ramp until you're at the max dosing, and sort of not paying any attention to, are people losing weight? Is their metabolic function normalized? Are they having side effects? How serious are the side effects? And so taking all of that into account, how do we support our patients in optimizing their dosing strategy? And that's something that I think is a piece of the conversation that's really important, is that we can, and that's how you and I practice, right, is individualized care.
Right. Yeah, I think you bring up great points, and my thought has evolved on this, a lot over the past probably year or several months. I used to think that this is just people are thinking this is the one-stop shop. This is the one pill that they need to take, and their weight gain is a deficiency of tirzepatide. And that's what I wanted people to avoid thinking. And the truth is, there is a benefit to these drugs, and there is a use case scenario where it absolutely makes sense. But what I've also discovered is, people aren't doing the basics, and when you're not taking care of your basic health, you know, trying to change your lifestyle, trying to change your diet, exercising. You can take these drugs, but they're going to have other consequences. And one of the big, I practice a type of medicine I call performance functional medicine, where really focus on muscle gain, building strength, building muscle, losing fat. That's my focus, and that's where I take my patients and help them down this path. If you're taking this medication and you're not resistance training, you're gonna not only lose fat, but you're gonna lose lean body mass. You're gonna lose muscle, and unless you're planning on taking it lifelong, once you stop it, you're gonna gain that fat back if you haven't changed your diet, and you're gonna have more fat, less muscle mass, and you're gonna be worse off than you were
Mhm.
before. So there are many reasons to take it. There are many reasons to hold off on taking it and try these natural ways first and see how they do for you. Ultimately, like I think we both would agree that if you can avoid taking this drug and you can
Mhm.
do this a natural way, that's the way to go.
Well, yes, I agree. And I think it's, the way that I look at the body is to nourish the body, right? So if we, and that's what we talked about earlier, is like, is for me, it's oftentimes about changing the lens. In this culture, we are very punishing towards our bodies in terms of our mental plane. Like we're supposed to look a certain way. We have to lose weight and we have to lose weight quickly. And we will starve ourselves fast, whatever it is, drink Diet Coke culturally, right? In order to slim down or to lose weight. But I love that you have this focus on creating a healthy body and maintaining a healthy body. And for me, a lot of that journey has been around, I choose not to do punishing internal dialogue, but also punishing therapeutics that I could have called therapeutics, that I could even justify in my mind as therapeutic, a 4-day water fast, something like that, right? Which is not what it was coming. It can be great, right? It can be helpful, the sort of calorie restriction, stimulating autophagy, all of that. But my intention was, I'm going to lose this weight, right? I'm going to lose. And so it was very punitive, the way that I was thinking about it. So I love the way that you're talking about it. And this is how I talk to my patients, is like, hands on your body. Thank you to your body, and working with your body and asking it what it needs, and learning to trust and listen to the signals. And if you use any medication at a high dose outside of what sort of super physiological is how I've been thinking about it, is, for example, we would never take testosterone and push it 10 times what we would typically create in the body.
Yeah.
Why are we doing that with GLP-1 meds? It doesn't make
Right.
any sense to me. It's
Yeah.
just like, seems like really common sense
Yeah.
to me. But if we are coming in with the lens of supporting a healthy physiology, and we get all of these other things that you've mentioned dialed in, and we can talk more about that if you want to too, what those therapeutics might look like, uh, that's a really different, sort of more nourishing and nurturing place to approach our body.
Absolutely. Yeah. Dosing is so important, and I completely agree with you. And I think the thought of these drugs are also evolving in terms of dosing as well. People are starting to take lower doses. They're understanding that, like, these high doses aren't really necessary for,
Mhm.
the weight loss effect that they want. They can take lower doses, and they can take it concomitantly with doing these other things that we're going to talk about now. So that leads us into the next question. How can someone naturally stimulate GLP-1 and GIP in their own body? And I guess going along with that question, you mentioned the half-life is so short. Is that really how we should think about it? I mean, should we think about, hey, I want to stimulate this, and this is what I should do? Or is the half-life so short that maybe maybe it's not how we think about it. Maybe we think about it some other way. So I just want to bring
Yeah,
that up for
no, I think
discussion.
I've had those same sort of questions, and I think it will depend upon the mechanism of action for the natural therapeutics, right? So if we're working the microbiome and their capacity to produce short chain fatty acids, or basically nourish the lining of the gut and stimulate the release of GLP-1, then in a healthy body, that would be ongoing.
Yeah.
Rather than where, if you're just taking a supplement, even a supplement like, the hops extract, or any of them, berberine, that would be, I would say, a sort of a short burst, right? So
Right.
you're going to bind bitter receptors and stimulate that. We would expect to see sort of a short-term response to that. That's why I sit in the space that I do, which is microbiome, right? And that is, when we have a healthy microbiome, healthy microorganisms growing in the gut, they're sitting in there interacting with the gut all the time. Of
Right.
course, they will react to the meals that we eat and the food that we eat, And so that's how part of the way we modulate the microbiome, but they will be consistently producing with the fiber we eat or what the foods that we eat, producing metabolites that will create more consistent release of GLP-1 and GIP and production of it so that when we eat, it's there to release. And sort of the other piece to this is that there is evidence that people who are obese or who have difficulty losing weight or metabolic dysfunction actually have GLP-1 resistance, which I think is
Mm.
so fascinating. We think of insulin resistance, but there's actually
Right.
they produce less and they have resistance to it. So then we have to think about how do we support their body's ongoing production of GLP-1 and resensitize them as well. I don't know the answer to that second part.
That's really interesting. So these hormones sort of, is it, does their production sort of wax and wane? Like you have like a constant level, and then when you eat, it sort of like peaks and then it troughs, etc. Is that what it looks like?
Yes, exactly. So GLP-1, GIP both are released primarily in response to a meal. So protein, carbohydrates, fat, all of those things stimulate the release of these incretins. And also bile and pancreatic enzymes. So the release of bile, which would be then a dual. So you eat, that makes you release bile. That will make you, both of those things will help you release more GLP-1. So we have the production and the storage of the GLP-1 in the L cells and the K cells, and it's sitting there waiting for a signal to release. And that would be a meal or the release of bile and other things too. Other short chain fatty acids, other things in the gut will also stimulate the release.
I see. Okay, so maybe we can start. You mentioned some other things. We'll start with the gut microbiome because that's where your expertise is.
It's my
Um,
favorite thing to talk
yeah,
about. Well, not really, but
right.
related to this. Yeah.
Yeah. So how does that help?
Well, so when we have a healthy microbiome, well, let's say this way. Well, how do I want to phrase this? Let's start this way. When we have a healthy microbiome, it helps us with things like hydration. Super important, obviously, is that we have adequate hydration in the body and the tissues. It helps us with systemically reducing inflammation. They help us with production of nutrients. There's this really interesting, one of my dear friends, Piper Dobner, was one of the founders of Thana Biotic, and they were looking at in healthy stool the metabolites from microorganisms that are living in a healthy gut. There were 1,500 of them, and most of them we've not even identified yet. So it's not just vitamin C and a short chain fatty acid here or whatever. We actually don't even know. What we do know is that when people have healthy microbiome, that they typically have better health more robust health across the entire body. And that includes metabolic function. I mean, that is extensive amount of research showing that. So let me see. Did I go sideways? What was the rest of your question? I get
No, it was
excited.
so I guess no, you answered the question, but I guess and I know this is a complicated answer. Maybe you can just give us like a sort of like a 2-minute summary, but how do you support your microbiome? Because you did mention
Yeah.
that, a healthy microbiome will enhance. My assumption is that it enhances GLP-1 and GIP release.
Yes, yes, it does. So through a number of mechanisms of action. One is that it maintains the health of the lining of the gut, which is where those enteroendocrine cells we talked about earlier live. So if you have a healthy gut lining, they can do their job. So that's an easy one, right? That's an easy lift.
Right.
If we get dysbiosis or dysregulation to the gut microbiome, that creates a lot of inflammation locally, which will damage those enteroendocrine cells. We have fewer cells able to produce the GLP-1 and GIP, and we have just down-regulated activity there, but at other areas in the body too, the gut-liver axis as well. And just a quick aside, we do have a research department, and we had one man lose 60 pounds modulating the microbiome in 6 weeks. So not common for it to be that dramatic, but it was really dramatic for him. And so this is an area where if the underlying cause of metabolic dysfunction is in the gut, then modulating the microbiome would be a true root cause therapy. So how I do that is working with biocidin, which is plant. It's 18 different botanicals. We have a lot of research showing it doesn't wipe out beneficial microorganism. It actually shows trending increase in beneficial microorganisms. And that's the beauty of working with plants to me, is that it doesn't come in like napalm and wipe out all the good guys
Yeah.
too. It helps to restore balance. And so just cleanse either annually or biannually to do something like a straight up detoxification, microbiome detoxification is how I think about it, right? A cleanse.
Right.
And to support, the other thing is to support the release of the bile and pancreatic enzymes with botanicals. And also I love TUDCA. I don't know if you're familiar. I'm sure you are, but
No, no, I'm not actually.
okay, TUDCA is a bile acid. It's a bioidentical bile acid that we create in our liver, but we're not making enough of it to keep up with sort of the environmental exposures that we have these days. And it thins and increases the flow of bile. So it just helps us to do a better, sort of more efficient job detoxifying. It's a very low intervention, something you can take long term to help just sort of stimulate the release of bile. And this is something I know when we talked at IHS, this is one of the things that I got really excited about is that the bile, I think right now bile and bile acids are sort of at a place where the microbiome was 20 years ago in terms of conversation, because the bile, when it gets released to the small intestine, all those microorganisms interact with them and create, so they come out primary bile acids, they get converted to something called secondary bile acids, and then as they move down the intestine, they get reabsorbed into the body. And they've now found bile acid receptors in every tissue that they've tested, and it's highest density in the brain. We
Wow.
don't know exactly what they do there. We just
Yeah.
know, and some of them we do know, but most of them we don't know. So I always just sit back into this humility, right? Of, we only know what we know, and it's probably a fraction of what there is to know. And
Yeah.
how do we, for me, it's safest to go about supporting the body's natural abilities to heal itself. And that's, I think, where you and I see eye to eye on this stuff is
Right.
it's, to me, responsible and say it's to go the safest route, which is to really support the body's ability to heal itself.
Absolutely. So when we're talking about sort of, fixing, quote unquote, fixing the microbiome, the standard things I think people have heard of, like, prebiotics, probiotics, eating more vegetables,
Mhm.
polyphenols, like if you have a sensitivity to dairy, gluten, things like that, you're stopping those things because if you have a sensitivity, that could cause inflammation and cause, other issues. Um, so say you do all those things, you're eating a healthy diet, you're eating, unprocessed food, and you still want to do this reset, or even if you're not doing it, you want to do the reset that you just mentioned. What is that? Is it like is it like something that a package that people can buy and just do it for
Yeah,
a month?
so you can get it at biocidin.com, which is biocidin.com. And it's called the BioClear Kit or BioClear Microbiome Detoxification Program. It's a long name, but that's why we called it a detox is actually when we have dysbiosis, if we have overgrowth of some of the bacteria in the gut, it's as toxic as any external exposure that can be. And so it's a piece that gets overlooked often in a detoxification program is just how powerful it is to work with modulating the microbiome for detoxification. So that's an easy 1 month protocol that you can do. And the cool thing is that I ended up using the biocidin as a diagnostic tool in my practice, because people, if their microbiome is playing a role in the way that they're feeling, then they will notice a difference when they use the biocidin. And that I saw that across the board. So I began using it instead of testing the microbiome, which there's a lot of controversy about whether we can even test the microbiome and whether those tests are valid clinically. And I have very particular opinion about it, but not exclusive. But I have because of the work that I've done, I think there's limitations. They can be very useful, and there can be limitations as well. But working with biocidin for me replaced the testing a lot of the time, because I
Interesting.
just worked the biocidin to see if people felt better when they, was their joint pain resolved? Did their psoriasis get better? Their headaches, their
Yeah.
insomnia, what part of their illness was related to the microbiome that would elucidate that for me.
That's really interesting. I have heard that about gut microbiome testing. Just this is a bit of an aside, but what are your thoughts on gut microbiome testing? It's
Well, so what we've seen, it's interesting because I'm lucky I get to sit in this position of doing before and after testing. We do a lot of research. We do everything from case studies up to pilot studies, and even we're launching research with Johns Hopkins right now on bacterial overgrowth in the gut and the use of biocidin. So I've gotten to sort of witness the before and afters. And what's interesting is there are so many different kinds of tests, there where we test the DNA of what's present, or we can culture it out and try to grow it, or we can look at what's called full genome sequencing or shotgun. So there's all of these different kinds of testing. And what I would say is that there's nothing really consistent with the clinical outcomes. So when people feel better and their symptoms get better, it doesn't necessarily mean that that's going to be reflected in the stool testing. Where I
Mhm.
do think that it can be really useful is, especially, I would say the PCR tests are the most consistent at reflecting people's improvement. So that's one thing, right? So if we have the GI
Yeah.
map, GI
Yeah.
map, I think is the easiest for us to kind of look at for a pathogen before and after. But so they can be really useful in like just assessing what's growing in the gut. And then there are other metabolic markers there, like the sort of the mechanical function of the gut, the inflammation in the gut, gluten sensitivity that you can look at. All of those things together can paint a picture of what needs to happen, where their therapeutic direction needs to head. But I think for me, doing after testing is kind of neither here nor there. It's whether people are feeling better, are their test results, other test results improving their inflammation, their body comfort, whatever disease process, because it doesn't, it just, it's not consistent.
Yeah, I absolutely agree with that. And I look at those big picture. I mean, I run that test myself with my patients, and I've had patients that have had positive C. diff, and they didn't, they didn't even know they had, just sort of like chronic infection of C. diff, and it wasn't very severe, but they take treatment for it, and their loose stool resolves. Like
Yeah.
things like that. You can discover gluten sensitivities, etc. But I totally agree. Kind of look at a big picture, not like
Mhm.
each little piece of it.
Yeah.
Okay, great. So gut microbiome, we understand a bit about that. What about lifestyle? What kind of things can you do to boost GLP-1 and
Yeah,
GIP?
well, so I think, there's so many things that are important. I think, sleep is really important to help us modulate that sort of that HPA axis, our hypothalamus, our stress axis, and adrenals. So that's really important. And then something that we talked about. Well, let's talk sort of the more mundane stuff first, right? Which is, I think you mentioned polyphenols. You can get polyphenols in a pill, but you can also get them in food. And so eating a rainbow of color, though, and prebiotics. So prebiotics are, for people listening, that is basically the food for the microorganisms in the gut that will help us produce what we need to in order to have healthy GLP-1 and GIP-1 or GIP production and release. So getting in a habit of eating those foods, eating them once doesn't do anything, right? It's the more of getting in the habit of making sure you're getting a lot of plant-based nutrients. So fruits, vegetables, even spices, right? So those count as plant foods too. So adding those extra seasoning and spices to your meal as well. So all of those things will help to feed a healthy and maintain a healthy microbiome. We do have on the Biocidin website, we have a microbiome, eat right for your microbiome diet. And that would be it would be a great diet for maintaining a healthy gut and also everything we're talking about here today. So
Great.
eating lower foods that are less likely to cause inflammation, making those the focus of your diet. So I tended to always prescribe in my practice, sort of modified paleo is what I would call it. I don't know if paleo is even really in anymore, but I would say, avoiding gluten and too much dairy, soy, and grains. I think, minimizing grains, to me, that those were things that would help people feel better right away. Within weeks, their energy levels are improving, their body comfort's improving, and that's again, getting out of the way. So that the body can heal itself. So that getting a diet, and the diet that works for each individual. Some of us feel great eating things that other people don't feel great eating, and listening to your body and having the courage to minimize and the discipline to minimize the foods that you want, even if they aren't good for your body, to have them once in a while as a treat instead. So diet, I think of that. And then we talked a little bit too about people who are having difficulty losing weight, especially that have tried everything. I think it's really important to include trauma and evaluation of trauma or what they're holding. So often we are holding trauma, but what are we holding in our body? That's the weight can be sort of like a protective mechanism. And I don't mean that I mean, cliches are a cliche for a reason, right? So there's some truth behind, I think, some of that, but it's more not necessarily like, I think one example would be like, oh, a woman who suffers a sexual trauma carries extra weight because it keeps her from being, attracting any kind of attention, But I think it's deeper than that. I think it's that when we hold that trauma, if we start to release from our bodies, and this is the body keeps the score. There's a book about this that completely changed my world, actually, when I read the book, is that until we release those, our body is protecting, holding it away from us, holding the experience and the reliving of the experience away from us so that we don't have to, so that we can carry on, right, with our life. And so that piece for me was played a huge role in my own weight loss experience. So I know I shared this with you, but I've been using tirzepatide. I've lost about 70 pounds in the last year and a half, doing a relatively low dose of the tirzepatide, but it was coupled with very intentional trauma work for me and somatic release, meaning when my body wants to move, I listen to it and I let it move, whether it's shaking or dancing or stretching or running, whatever it is, I'm
Right.
listening, tuning into, and have the intention of letting go, examining what is it that I'm holding on to. So when I'm working with patients on this med, if they plateau before we change any dosing and before we even do anything other than maybe adjusting their diet and lifestyle a little bit, it is asking them to explore with themselves, what are you holding on to? What is it that you need to work with? And the taking tenderness towards yourself. That what is it? What is it that's there that I'm housing in this weight that I'm resisting, addressing, letting go of? And it can be anything.
Yeah.
It can
Yeah.
be
I mean,
anything. So
we were talking about this before the podcast. Mental health is so important in this journey, right? It's really understanding what's happening, having some insight into your own thought processes and things like that. And expressing them is so important. But let me ask you this. Does that gut brain axis, does that play a role in this GLP-1 and GIP secretion?
yeah.
I mean, is that increased parasympathetic tone maybe from relaxation stimulating that GLP-1?
So let me think about that for just a second because I haven't really thought about it in that way before. But so we know, so the vagus nerve is, largely in the gastrointestinal tract, that the signaling between cortisol, serotonin, and the lining of the gut will signal the vagus nerve and the ability to relax, the ability to go into parasympathetic or relaxation mode. There are GLP-1 receptors in the brain, so it's not GLP-1 is produced in the gut, but we absorb it and it from the gut and it goes into our systemic circulation. We can also stimulate the release of GLP-1 in the brain as well. So I don't what I don't know is what the research shows, but it's a very logical assumption to make that whatever's happening with the gut brain axis will influence GLP-1.
Interesting. Excellent. What about whey protein? I've heard that stimulates GLP-1 directly. Is that true?
So I know there's evidence of that. That's not something that I have prescribed or that I've used myself, mostly because, and it's probably an innate bias against dairy in
Yeah.
my practice, right? Is that in naturopathic medicine, dairy is one of the first things that comes out in an elimination diet. But that being said, some people really do well with dairy, the same as they would with, colostrum or, if I'm honest, I do here and there indulge in some dairy myself.
Right.
So I mean, I'm a perfect example. Actually, I do really well with cottage cheese as a source of protein, which would have some of that whey in it. But it does have whey in the research does have an incretin and satiety response. So it does help promote the release of those, not just GLP-1 and GIP, but some of the other satiety hormones that we release, or peptides, small proteins that we release in the lining of the gut. So it does have good research. It's pretty accessible and affordable. And I think especially people, whether it's whey or collagen or some other easily utilized protein, that's something that needs to be focused on. I know you mentioned that retaining like muscle retention or lean body mass retention, it can be very challenging, especially if you're dosing at the beginning when you first start these therapeutics, and then over time, if you continue to increase it, people lose their appetite. So having some easily accessible protein sources,
Yeah.
that can be really helpful. Like for me, broth with collagen, or you could do whey protein. That's something that I can do to support if I'm like, oh, realize I'm not getting my protein in.
Yeah.
And then can I ask you a question?
Sure. Yeah, sure.
How about creatine? What do you think about creatine?
Oh, so that's a great question. So going back to whey, I'll answer creatine in just a second. But whey protein, I recommend for those who don't have an intolerance to dairy, and I run sensitivity tests on some of these folks, and like very often milk protein comes up positive. And just as you do, I frequently tell people not to take dairy, not to take gluten. But whey is actually one of the most studied proteins in muscle building because it has a very high leucine content. And you
Okay.
need, when you're looking at amino acid profiles of different protein, you need high leucine in order to build muscle. That actually stimulates mTOR, which is like sort of it's similar to a receptor in your muscles that causes growth. So I recommend whey. If you can't do whey, pea and rice protein is a good substitute. Creatine has also been um, studied a lot, and it's probably one of the most highly studied supplement. And in fact, I recommend that as almost almost to everyone as part of my natural stack or fundamental stack of
Okay.
supplements. Um, and you can take that just a 5 gram dose daily. Pretty much everybody takes the same amount of dose. You don't have to load it or anything like that. But I find it to be very helpful. Not only does it help people lift heavier weights, and sort of like you kind of it causes water retention in your muscles, so you kind of look a little bit bigger. And even if that's not necessarily your goal, that you do when you
Hey.
take creatine, but also you feel better. It's sort of like it just helps with energy production in general.
Okay. Thank you. I'm taking notes.
Yeah, right. Excellent. Okay, so we spoke about your GI microbiome. We spoke about lifestyle, diet, prebiotic fibers,
I
addicts,
mentioned one thing
etc.
about prebiotics is that oftentimes, so at least with the population that I was working with, I have a very small practice now, but in the past, when I had a full-time practice, a lot of the people I was seeing had dysbiosis. And so if that's happening, meaning you have sort of a imbalance in the good guys versus the bad guys. That's the simplest way of thinking about it. But
Okay.
then you sort without correcting that first, you feed with prebiotics, you can actually aggravate people because you're
Mm,
going to feed both the good guys and the bad guys with some of those micro with some of the prebiotics. And so it was something I meant to mention before. So prebiotics, yes, but not until the microbiome is corrected if there's dysbiosis.
interesting. I was going to ask you this. I'm glad you brought this up. These natural antibiotics, how do they only target the pathogenic types of bacteria? How does that work? Why
I
not
know.
all bacteria?
I know, right? So I've had to think a lot about this, and so this is where I've landed, although it's theory. So I just want to acknowledge that. But what we do know is that those plants exist in the same world that we do, and they
Right.
have some of the same pathogens, fungal elements, or what bacteria that and parasites that we do. And so they have some of the same beneficial microorganisms that we do. And so basically we are calling on the defense mechanisms that the plants have created. And so they will have naturally evolved to spare the beneficial microorganisms. Not all of them do that, right? So some antimicrobials will damage the commensals or beneficial and beneficial microorganisms and can create a temporary imbalance. But many of them do not cause harm to the beneficials, especially when used similarly to how we talk about the GLP-1 meds when used in a way that's thoughtful, right? So the same thing, we don't want to take oregano oil at a super high dose is going to cause some disruption in the microbiome. Will it get rid of that pathogen? Possibly, but then you have to go back in and restore. But when you use something, I think where the benefit to biocidin comes in is that it's tiny doses, so it's dropwise dosing. It's a tincture. Called a glycerite tincture. It's actually sweet. I describe the taste as sweet pizza because it has oregano and garlic in it. I've never had a kid not want to take this product. It's unbelievable. Just in terms of getting the patients to want to take the therapeutic, it
Right.
actually tastes good. And I always use the liquid because we also have a microbiome in the mouth, and
Right.
it's second only to the gut microbiome. So I always work with the liquid so that you're treating the oral microbiome. And we swallow what's in the mouth. So it's an important part of the gastrointestinal tract, is how I think about it. But when you use something that's, 18 botanicals in a drop, you can imagine you're not getting very much of any single thing. And
Right.
it seems to be the synergy. And I could go into that. I can wax on about the beauty and the efficacy of plant medicine, plant medicines because they're so powerful yet nurturing, nourishing, and they actually call our body into action too. So they're not just antimicrobial, but they stimulate our immune system. They reduce inflammation, they're antioxidant. There's all these layers of activity that seem to create this outcome that is supportive of healthy microbiome and healthy physiology in the gut. And I'm sure but maybe the listeners don't know, we have up to 85% of our immune system in our gut.
Yeah.
So why is that important to this conversation? Because our immune system is what mediates inflammation in our body, and inflammation and metabolic dysfunction or blood sugar dysregulation go hand in hand. So it's all very connected. I don't know. That was a long response to your question.
Yeah, yeah. No, I like how you framed that, because I wasn't really thinking about it that way. I mean, the way, in conventional practice, how I was trained is that you sort of ignore the herbals, right? Or you look at the side effects, and if there's a side effects with the current pharmaceutical that the patient's taking, you like say, oh, stop taking this herbal, it has a side effect. It's, you when somebody's got a bunch of these medications, the traditional, like, MD approach is like, this is not doing anything for you. That's sort of the thought process. But yeah, as I have been exploring this space, I've realized that there's absolutely a benefit to these plant-based medicines. In fact, a lot of our pharmaceuticals come from plants, right? It's just super concentrated and isolated. And the great thing is the side effect profile is so much better than pharmaceuticals. I think it's important to decide, how and when and why you want to take something, because like there is, the safety is important, but then also there's the expense of it. You're sometimes people are hawking certain things, or like, this is the way to go, and you're paying a lot of money for maybe nothing. But the way I've actually started thinking about it now is, number one, is the safety profile good? And if it is good, then and you know you're buying it from a reputable source and has third-party testing, etc., then try it. And if it doesn't work for you, that's fine, But if it works, then that's great. That's
Yeah, and it's been fun to sit in a position of being able to get some research done on these nutritional supplements, because it's just very exciting, very rewarding. I mean, it really research on, we have a published case study on molluscum contagiosum, which is a viral infection for kids. It spreads like wildfire in a daycare setting or a school setting. Takes 6 months to 2 years to resolve on its own. And we just watched this 14-month-old baby had lesions over his entire body. His mom couldn't even hug him because he had infection in a lot of those lesions. And I think it was 6 weeks or 9 weeks that he had resolution.
That was a case study with biocidin. I saw that. Yeah, that was very interesting.
It's very dramatic and exciting. I mean, that's one thing. We have, Borrelia research, so Lyme disease, and just general dysbiosis stuff. It's so if you're curious about it, you can go check out our website. We have the research on our website.
Yeah, and I think that's important for listeners to understand too, is that, like, a lot of these things, especially the things that you're mentioning here, there is research behind it, and you have to, like, the clinical research is important. The in vitro type stuff is certainly interesting, but, like, you want to make sure that it has clinical relevance. The other thing to keep in mind is, like, a lot of these companies, I think we spoke about this briefly in the bio side, and, like, it's expensive to do a research project, right? It's like you're putting a ton of money and energy into it, and a lot of these companies maybe can't afford it. It doesn't make sense. If the study's not powered highly enough, maybe the results are not going to be you'd ideally like, or maybe they don't show what the supplement can truly do, or the ingredient or what have you. So it's a tough path to go down to do some of these very high powered clinical studies. A lot of these big pharma companies can certainly afford it, because they also will make billions, from that, from a particular drug, which is not the case for these. So it's all, a lot of this stuff you have to keep in mind when you're looking into this space, and it requires some thought. But yeah, that's why I feel like going to someone you can trust is so important.
Well, I agree.
Yeah.
I would.
Yeah. Okay, so now going to, we spoke about a lot of things, but one thing I want to explore a little bit is also botanicals that increase GLP-1 and GIP. Yeah, I've heard, like, berberine, ginger, bitter melon, things of that curcumin. Those are some of the ones I've heard about, but can you just expand on that? Is that true? Is it something that people should take?
Yeah, and I think sort of what we were talking about earlier is important to remember that they act differently. So you could combine ones that act differently from one another, maybe to stack them and get a better effect, but to be aware that working with gut health and the release of it naturally is going to be where it's at, right, in terms of ongoing production. I'm saying that because that's what my theory is. I want people to know that we're still in the phases of really understanding from a research perspective. But it is, you were just talking about research, and these compounds that have research, that's an easy intervention, right? We're gonna give them curcumin, or we're going to give them berberine and look at before and after. What is a little harder is what happens when someone's health is better in general, and we've supported a healthy microbiome. So it might be a while before we really understand the full gamut, or what that really looks like. But that being said, there are some really cool research nutritional botanicals. The one I think that is getting the most sort of attention right now is calocurb. Have you heard of that? That's hops. It's bitter. It's So hops are what make beer bitter, like an IPA.
Yeah.
It's really high in hops, right? And so we know of it as a sedative, but the bitter activity in it stimulates the production release of GLP-1 and other peptides, again, too, in the gut. And so that has some good research behind it. It's more spendy because they have done the research. And so that's the other thing, is when a company puts a lot of money into research, typically their product is going to be more expensive as well. So that's one that's getting a lot of research right now. Berberine, you mentioned berberine as well. So I had to do a little research on the mechanism of this one. I bet that you know more, considering your background on how berberine works, but it's that it activates AMPK. And I'm just guessing that you know more about AMPK than I do. So I can talk about it, but if you know more, if you know a lot about it, I would love to give you the mic on it.
No, no, no. The only thing so the way I look up these supplements, and I encourage everyone to do this, is I use examine.com. I don't know if you've heard of that resource or not.
Yes. Oh yeah. Yeah.
Yeah, and I pay for the pro version, but basically you can look up any of these supplements, and all the research, or at least a lot of the research, the relevant research, is posted, and they grade it, for different conditions. So berberine, for example, if you look it up on examine.com, a lot of the studies show that it in fact does decrease, your overall blood glucose levels over time. I think it also helps with satiety, and it mimics metformin. That's sort of my understanding of it. And its side effect profile is excellent. So it's one that I do recommend to people that have some metabolic issues. Maybe their blood glucose is a little high, hemoglobin A1C is a little high. I recommend to try that.
Berberine is also really potent antimicrobial.
Oh, is it really?
Yeah, so I mean, that's how I learned about it in my herbal medicine classes. Past year was primarily as an antimicrobial for acute infection. It can be used, but it's really great for microbial health. And so there is some golden seal is the botanical that is high in berberine, and Oregon grape. I think we have golden seal we do have some berberine in the biocidin, but very low dose. It wouldn't be doing what like just a straight up berberine would do. So, but it's interesting because it makes me wonder if there's some of that activity that might be promoting the metabolic balancing as well, would be balancing the microbiome as well, too.
Right. Oh,
Same
that's
time.
interesting. So that the first product you mentioned, the hops derivative, is that how would one purchase that if they're interested in?
Well, I don't know. The one that I'm looking at is calocurb, or the one that I've been reading about, and that's CALOCURB, and it's a name brand supplement.
Okay.
Do you have a favorite for berberine, if you don't mind me asking?
Yeah, I usually go to Full Scripts is the site I go to, and then Pure Encapsulations is
Okay.
my brand, the brand that I typically recommend. But there's a lot of them out there. Pure is just, I find it they're pretty solid overall.
Yeah.
And let's see, curcumin, ginger. What are your thoughts on those?
Yeah.
You
So
mentioned ginger.
I love ginger, and I love ginger for so many things, but it would be really great for not just for the natural production of GLP-1, but also for people taking the GLP-1 medicines for nausea. And it will promote the release of bile, so it will help increase your body's production of GLP-1 as well. So again, sort of dual purpose. That's what I love. This is what I love about plants, right?
Yeah.
It's
Yeah.
working in multiple ways to support health, but it does so it improves motility. So the movement of the gastrointestinal tract, it's called the migrating motor complex. So it will help stimulate the healthy movement of food through the gut, which of course is something that is impaired with it's one of the most, well, I think the most common side effect of the GLP-1 meds is nausea, followed by diarrhea, constipation. And so these medicines that help settle the stomach, promote the release of of bile, and also healthy motility. Those would be like a first choice for me. And I'm seeing that work really well with patients as well, both who are just wanting to support healthy digestion and healthy metabolism, and people using the GLP-1 meds. It's ginger, or in a formula that does, where you sort of can get a bunch of botanicals together that will support in that same way.
Is there like a biocidin formulation where it has a bunch of these that can help?
We have a couple of them, yeah, actually. So one of the products that's kind of, I would call it a sleeper in our line. It's been around for over 20 years, and I absolutely love it. It's called Biotonic. So it is actually Chinese medicine, botanicals, two different formulas together, and it stimulates stomach qi. So if basically it's going to improve your digestion or digestive fire, and it stimulates immune function as well. And for in general, for releasing bile, pancreatic enzymes, supporting healthy digestion and a healthy microbiome, that one used as needed and then consistently, you could use it twice a day. So Biotonic is different from the Biocidin, and the Biotonic is really great for people who have nausea in response to the GLP-1 meds, and in general for supporting it. And then the other one is a brand new product called Liver GD Plus. And I know we talked about this one at IHS together, but it's great. It has curcumin, so it has turmeric and ginger. So two of those on the list that have research behind them. It also has TUDCA, which I talked about earlier. It's a bile acid, a bioidentical bile acid. And it has artichoke as well, which again is another bitter. So we talked about bitter herbs and how this is how a lot of these therapeutics work, is to bind bitter receptors, and that's what stimulates the production and release of GLP-1 and GIP. So a combination, and then milk thistle as well. So Xylifos, it's actually a patented milk thistle in it. I am in love with that product. It's pretty brand new. It only came out in January, but man, it's you open it. Have you ever had this experience where you open a bottle and you're like, and you just want to
You can't put
sniff
it
it,
down.
and you could just tell when you open it, that it has it. So I love that brand new product.
What is it? What's the use case for that? For that, when would you use that?
Well, so this is one that would be both helpful for stimulating the body's natural production of GLP-1 and GIP through the release of bile and binding bitter receptors. So two different mechanisms there. It's also really helpful for people that are taking, especially when they're first starting the GLP-1 meds, because it will increase, it basically counteracts that delayed gastric emptying from the GLP-1 meds and the reduction in the flow of bile and pancreatic enzymes, which is where some of the more serious side effects of those meds come from, this reduction in bile flow and the delayed gastric emptying. So it would be useful for both of those. So a one capsule twice a day, or you can use it as needed as well. So if you have some digestive upset, you feel like your food's sitting in your stomach, and this doesn't have to be on a GLP-1 med, but anybody in general, it has that motility, will sort of help move your food the direction you want it to move, which is, down and through, rather than sitting in the gut. And I think just in general, the toxicity in the environment is at unprecedented levels right now. And so just to help keep our livers clean and healthier, it's a great
just about promoting flow of bile and your GI
production
tract.
of and flow of, and then thinning it so that you're less likely to create stones, and sludge in the gallbladder as well.
Interesting. Well, Jocelyn, I feel like we could talk for another hour, but it has
Me
been
too.
a bit over an hour. I really appreciate your time. This was really amazing, and I feel like our listeners will get a ton out of this. If someone wants to learn more about you and Biocidin, how would they do so?
I would just go right to biocidin.com. I don't, so I don't currently, I'm not taking any patients right now. So there's that piece of it. But if you want to learn more about biocidin and the microbiome, including GLP-1 and the microbiome, we have all of that information on our website as well. And there is right now, actually, for a short time until we get our website straightened out, anybody can access all of our educational resources. I don't know how long that will be the case. You don't even have to have an account right now to log into our practitioner education, but there's a protocol there that I wrote on GLP-1 and the microbiome, GLP-1 GIP, and it's all of the sort of everything from the demographics, epidemiology, benefits, side effects, clinical pearls, and how to maintain a healthy lifestyle and work with those meds, or for people who don't want to take those meds. So all that information's in that. It's on the website.
Oh, excellent. Okay. Well, I'll put a link to it in the show notes. Could you send me a link via email and then I
Yes,
can
I will.
put it in there? Okay, excellent. And one last tip I want to give folks before we close, and this is something that I discovered personally. I heard about this is taking apple cider vinegar before a meal. I don't know if Jocelyn, if you've tried this or recommend this to your patients, but I tell all my patients to wear continuous glucose monitors. I mean, I think it's a great way to just check your, your overall metabolic health and your blood sugar, how it reacts with certain things. But if you take apple cider vinegar, just like 2 tablespoons, mix in water, maybe 30 minutes, 10 minutes before a meal, it strongly impacts your blood glucose. It's so interesting. So and there's multiple reasons for it. I won't go into detail, but it's just something that's easy. It's cheap. It's worth a try. Just want to share that with everyone.
Yeah, no, I agree with that as well. And you know what's funny? I'll just give a quick anecdote.
Sure.
When I came out of medical school and I was working with a rheumatologist, and I recommended that, and I forgot to tell her to put it in water.
Oh yeah, yeah.
So she was just drinking like a pH of 2 or 3,
Oh,
and it was
geez.
burning her esophagus,
Yeah,
and it made
yeah.
her throw up. So that's how we learn in medical practice. But added to water, it is a really powerful therapeutic. I love it, and it's supporting stomach acid and the release of bile and pancreatic enzymes. Like, it's just exactly doing what we talked about the rest of this conversation.
Yeah.
So yeah,
Awesome, excellent. Well, thank you again. Hope to have you back.
thank you so much.